Welcome back to Open BXRx. With most people barred from visiting patients in hospitals and many patients tragically suffering and dying alone due to COVID-19, New Yorkers have banded together to create an initiative called iPads to Hospitals, aiming to bridge the physical gap between sick or dying patients and their loved ones by organizing the donation of iPads to hospitals in need. Joining us now to tell us more are Ian Kaplan and Shenara Musthaq of iPads to Hospital. Thanks for joining us.
Thanks
Thank
for
you for
having
having us.
The first thing I wanted to get into, firstly, I'd like to say I just really love this initiative. And I first saw it on New York Nico's Instagram, a video that he posted. So kudos to you for putting this together in our city, and thank you.
Thank you, and we're very happy to have Nico on the team. He is he's an acquaintance through the industry, and when I told him what we were up to, he's getting involved in much more than just posting about it. He really cares, and so we appreciate him spreading that word. Absolutely.
So glad. It's all about community. So the first thing, what made you all start the iPad to Hospitals initiative here in New York?
Yeah, so I think I can speak a little bit to that. So this initiative was started at SUNY Downstate College of Medicine by two of my classmates. I was really lucky to get involved into the initiative in the really early stages, but it was kind of started by my two classmates who saw a need in two different sectors, I guess. So one was volunteering to call patients who were in the hospital who had been tested for the coronavirus. And when they tested positive, they called the patients' families to go over, kind of what that means, what are like the quarantine instructions for the families, and what the visitor restrictions were. And kind of noticed that it was really off-putting to families to hear that they couldn't go see their loved ones when they were, alone and sick in the hospital, and some people very sick. And then on the other side, another one of my classmates was speaking to an ER physician who, on the healthcare worker side, was just really devastated by seeing all these patients in the emergency room alone, and kind of unable to communicate with loved ones. So just coming from those two sides, it was this idea was kind of born out to use technology and use iPads to kind of bridge that gap in communication.
And that was something that about 8 or 9 days ago, which feels like a lifetime in the scale of what we've been doing, I caught wind of that very effort happening. And since then, as a group, of very dedicated volunteers, we have all grown this thing into something that is continuing to react to the demand that we're being told explicitly from hospitals that they could very much need. So as we kept seeing hospitals needing those units, we just kept growing our infrastructure, which we still are.
Can we talk about the process behind acquiring the iPads and getting them from the donor to the hospitals?
For sure, yeah. We're accepting donations in a variety of different ways. The lifeblood of this concept was the idea of that thing that you may have in your drawer or in your closet that is of no use to you anymore being of this life-changing use to somebody in need. So we're all about used donations, and we're collecting those in the 5 boroughs through volunteer drivers and a contactless pickup solution. And we are also having people donate these iPads to us from all across the country, which has been an amazing thing to see. So a lot of used iPads in the mix. We're also fundraising for dollars on GoFundMe. We're just shy of 20,000 as of us having this conversation. And we've locked in pricing to be able to get iPads at roughly $100 a unit. So we're using donated funds to be able to also buy refurbished iPads. And then we're also in touch with corporations who may want to get involved and get some of their older iPads in the mix, So there are all of these different ways that we collect them. We bring them together, we log where they all came from, and then we kind of divvy out based on the demand of that day where we can best send them, and we drop them off to our points of contact at the hospital.
I saw it on your website, the reasoning why iPads are the device that you're going with, but can you just tell our viewers why?
For sure. Yeah, we to be sure, we are accepting if somebody has a Samsung or an Android tablet, they can reach out to us and we can make use of anything at this point because the demand is so high. But iPads best ensure the success of a connection because they have FaceTime on them already. If you have an Android tablet, there's no FaceTime, which is still usable, and not everybody has an Apple product, So we don't want to be exclusionary, but we're putting our weight behind Apple. because we can get the best results from it.
Got it. And now, how many iPads have you been able to donate so far?
We have been able to donate, I guess with today's, we're at 130 that we've dropped off to hospitals. We have just about 200 more that are in the mix right now that are either on their way to us or being processed. And those hopefully will be in the hands of hospitals very soon. So that number is growing more and more each and every day too. So we're very excited. At the same time though, we are nowhere near reaching the demand of the hospitals asking for these in New York City alone. We will always be chasing that demand while we're in this current crisis.
Right. Can we also talk about the importance of targeting underserved communities and hospitals with less funding with this initiative?
Yeah, absolutely. Shenara?
Yeah. So, this initiative started at Downstate, and, we wanted to make sure that we were targeting mostly publicly funded hospitals where most of the dollars that are being, directed are going towards more healthcare delivery, more so than having the kind of extra like technology available. So, we wanted to make sure that we wanted to make sure that we're fulfilling that need. So, we are targeting these hospitals because the patient populations as well might not have the devices with the capability of video chatting. And then on top of that, the hospitals might not have the technology available to fulfill that need. So we wanted to make sure that we're stepping in there first. And additionally, we found that these hospitals that are serving kind of who are serving underserved populations are the ones that are kind of being most affected as well. So we see that because of kind of secondary health problems like air pollution or socioeconomic status, that there's a lot more comorbidities that are making these populations more susceptible to the virus. So while these hospitals have maybe less resources, they're also getting hit the most with the greatest patient population. So that's kind of why we chose this demographic.
Got it. And now about the nurses and doctors and how they're reacting to the donations that you're bringing to these hospitals. Can we just hear a little bit about that?
Yeah, and I think it would be helpful to hear from both of us because I, up until a week ago, had nothing to do with this world, and so obviously I'm impressionable, but I also am not used to it. And I can say from the outside, it has been humbling and overwhelming to hear the appreciation coming from people resonating in such a universal way, in such a way that really I can't help but feel tied together to these people, and it's a beautiful thing. And it's tragic, and I wish we didn't have to be doing this, but it is an incredible thing, and the response has been overwhelmingly appreciative.
Yeah, I would definitely second that. Unfortunately, as a medical student, I haven't been on the front lines at all, but I've been, I have a lot of friends and colleagues who are, and just the physical toll is, is almost equal to the emotional toll that it's been taking on a lot of healthcare providers. So just to feel like they have to take care of these patients in terms of their healthcare, and then also have this added level of, being the ones that are facilitating communication in this time is kind of unprecedented, really. So, they're very appreciative of this idea coming out and for us fulfilling these orders. And yeah.
How can people join the cause to donate and get involved with this initiative?
Well, our website is www.ipadstohospitals.org, and you can find everything that you need there, our mission statement, our objectives, a link to donate your used iPad through a Google form submission, and also a link to donate dollars if you have any to spare to our GoFundMe. Any amount counts. Those are the two potentially like most direct ways to help. But in general, if you don't have an iPad to spare and you got to hold on to every dollar you have, we completely understand that. Spreading the word is completely free. And that is another huge way that people can help us. Folks like New York Nico with a big audience, but folks just talking to their friends and family, it all makes a difference. So spreading the word, absolutely. And I would like to also say that we are completely open to suggestions from healthcare workers. Our ears are open. If they are out on the front lines and they are seeing a way that our efforts could potentially be better focused on resolving an issue, we're always receptive and we're always listening. So I would encourage anybody to reach out with feedback.
Ian, Shenara, thank you so much again for spearheading this wonderful initiative.
Thank you very much.
Folks, again, to see how you can help and donate to the iPad to Hospitals cause, please visit iPads2hospitals.org. Open BXRx. We'll be right back.